Hello, everyone. This is Lisa Johnson from Everbridge. Thank you so much for joining us today. Our webinar is about the CMS Interpretive Guidelines for Emergency Preparedness, which just came out a couple weeks ago. I'm joined today by Eric Chetwynd, the General Manager of Healthcare, who I'll introduce in just a minute. Just a reminder, we will be recording the video today. We will also be providing a copy of the slides and other resources that we'll bring up during today's webinar. At this point, I'm going to turn it over to Eric. Eric, welcome.
Oh, thank you, Lisa, and thank you again, everybody, for joining today. So today we really want to talk a little bit more about the CMS Emergency Preparedness Guidelines and share some insights that we've gathered from reviewing the interpretive guidelines recently just released, essentially, from CMS to kind of provide some guidance around what to expect, both from surveyors and really some more detail behind what those guidelines contain. And just as a reminder for those of you who have been following this, the CMS guidelines became effective in November of last year. And so we're in the first year of those guidelines. Really, the key dates to watch are November of this year is when surveyors, including the Joint Commission, will first start leveraging those new guidelines in any surveys that are conducted at your facilities post that date. And so that's really what we're working towards. And, you know, a little background on why CMS has taken this approach with the guidelines and included them in the conditions of participation. As I'm sure many of you are aware on the phone, we've had a series of emergencies and disasters over recent years, ranging from evacuations of the NICU at Bellevue in New York City, down to mass casualty incidents such as the Orlando shooting, evacuations in Louisiana. We've had several of those incidents over the recent past few years. And then ranging over to Ebola and other epidemic outbreaks that have occurred. And so CMS has really been looking across these probably for the past 10 years or plus, and has, based on that, come up with these guidelines really to help ensure that provider organizations are well prepared for the next set of emergencies, and that they're really providing that guidance. And behind that, they've not only put guidance, I think a little different than what you may have seen in the past. Obviously, there are a lot of emergency preparedness guidelines out in the market today, and there have been rules and regulations, including the Joint Commission has obviously looked at this for a while. CMS really has put some financial penalties behind this as well. And so the first one is they are treating it very seriously. They're calling it a condition level deficiency. That's one of the highest level deficiencies that you can have on your survey, and can put you at risk for actually losing CMS, basically being CMS compliant with the conditions of participation and being able to bill for Medicare and Medicaid patients. Typically, that would be after a remediation period. So the surveyors have some options around that, but it may be something on the lines that if you're found deficient, you have 60 to 90 days to become compliant with the regulation before any further penalty is incurred. Now, with nursing homes, nursing SNFs, and home health agencies, there are actually additional financial penalties as well that are in the non-compliance for conditions of participation, which range from per instance to per day kind of penalties. So there's a series of tools available to the surveyors which really were not there previously with groups like the Joint Commission for you to be aware of. So let's talk about really the 6 types of emergency preparedness planning. And CMS really has taken the approach of looking at what they're calling an all hazards approach. And so in the original rule, for many of you who read that, that included epidemics and pandemics, of course, biological incidents, chemical incidents, radiological incidents, fires, and then natural disasters, right? So tornadoes, hurricanes, flooding, etc., is really the elements that CMS specified. They've actually added more clarity. We'll kind of highlight that as we go through the IGs in a few minutes, adding some additional conditions really to make sure that we're looking at. With that, just real quick, I think we jumped ahead a little bit on the introductions, but you know, I think Lisa introduced me. I'm the General Manager of Healthcare here at Everbridge. And we've been working on certainly these CMS regulations for a while. And Glad to have Lisa joining me as well from our healthcare group, also bringing a lot of healthcare experience to today's conversation and the content that you're seeing. So the final rule, again, as we mentioned, came out late last year. And really, it talks about being comprehensive and flexible, a comprehensive and flexible approach to the regulation. And so when we look at the IGs, they really kind of take that to the next level, although they provide more refinement. The focus really is, as I'm sure many of you on the phone are aware and are thinking of on a regular basis, safeguarding human resources for healthcare. That's certainly patients and staff, employees. We'll talk a little bit about additional human resources that CMS really highlights. Maintaining business continuity, and so there's definitely clarity in the regulations, not only about what we might typically think about as business continuity, such as making sure we have power, for example, for our facility, but there's a lot of clarity about supply chain, as well as even thinking about electronic risks, such things as cyber attacks. And then, of course, protecting your physical assets. In addition to the interpretive guidelines, so there's a lot. For those of you who have had to take the time to go through the original regulations, they were fairly lengthy. The guidelines are another 72 pages, but do provide a lot of clarity. Those are available from CMS. There are also other resources at your fingertips, including the Tracy site has information available to you about how to interpret those guidelines. And then we've also, here at Everbridge, have put together some materials, including some white papers and some other resources that Lisa will send out post this event to share with you as well as you prepare for this rule coming into effect. So what are the two big takeaways? And really this is from our perspective, kind of summarizing up the interpretive guidelines. One is, the first really is CMS is highlighting that you need to plan for the worst case scenarios. And so that is the worst case and kind of the broad case. So that is really taking an all hazards approach and thinking about the many different types of events that can occur, everything around from a localized event within your facility, really up to a regional impact kind of event like a hurricane. The second thing, and really building on those larger events in particular that CMS highlights, is community planning and making sure that you really are interacting with your community resources. We'll talk, there's a lot in the interpretive guidelines about that. We'll talk about that as we go through today's presentation. So when we think about planning for the worst, really CMS has highlighted a few things. So care-related emergencies, certainly, and those are things, particularly for those of you in provider organizations, are thinking about on a regular basis. Patient care type emergency scenarios, ranging from, including things like mass casualty events down to localized events. Equipment and utility failures. So really thinking about, I think another thing many of you probably think about on a regular basis, power, water, electricity, gas, etc. Making sure you have backup systems for those. Obviously, there have been some well-known examples where in recent years, especially in large disaster scenarios, those have become real issues to not only make sure you do have those elements present, but also have contingency plans for when those are not available to you. In particular, CMS has highlighted, of course, power, and there's a lot within the regulations around generators and power supplies. One of the other elements that is new to the IG, and wasn't really in the original plan as much, is really thinking about electronic issues. So cyber attacks on your critical systems, what to do if a cyber attack, for example, is launched against your EHR in an emergency situation, kind of what your backup plan is for that downtime event. And then, of course, the last one, and this talks a lot about working with your community, is thinking about your supply chains, right? So what resources do you need to have in-house? Food, obviously food, medicine, other supplies, and how are you going to coordinate that in an emergency scenario, and kind of what are your backup plans for activating that?
We're going to introduce our first poll for today. So this is a question, if you were on our webinar in April when we were talking about the Joint Commission versus CMS guidelines, we actually asked you this poll question, and we just launched it, so you should be able to vote now. We had over 80% of participants vote back in April, so let's see if we can beat that today. And let us know all the different ways that you communicate, a paging system, text messaging, email, phone tree, or a mass communication system. And I am going to close the poll. So you should be able to see that on the screen, which is interesting. There's definitely, the answers are a little bit different than we had a couple months ago. So email is the number one, followed by text messaging and then a paging system. So just so you guys can see, I'm gonna hide the results, but then I'll show you how you answered back in April.
All right, and I think, thinking through, as many of you probably are aware, communication is really a large part of both what's in the IGs as well as the original final ruling, and so plays a key component to how CMS is guiding emergency preparedness. So really, as we start to dive through, thinking about around the communication elements, as we start to dive through the actual IGs, one of the key elements that came out really is the communications necessary for essential personnel. And so as this includes, beyond sort of what many of you may traditionally think of as the folks you may contact. So certainly includes your on-duty staff. Obviously, many of you probably have plans in place where you're contacting your executives and stakeholders during an emergency. But really, CMS has expanded this out. So the first element is really thinking about off-duty staff. And so that's tied primarily to things like surge capacity and, do you have to have a surge, particularly if you're a large facility, if you're a hospital, for example, or if you have to call folks in for sheltering in place, those kinds of elements. And so CMS has really kind of highlighted that you need to have a way to communicate with those individuals as well as your on-duty staff. The second one is really contractors and service providers. And so this ties back to thinking about everything from evacuation, where how are you going to coordinate with your transport vendors, for example, to route patients to different locations, to how you might be coordinating to bring in extra meds if you're going to shelter in place, for example, during a scenario. And so thinking through those elements ahead of time and having those contact and communication pathways basically already pre-configured. Volunteers is another one. And so for volunteers, they're really clear too that it not only includes designated volunteers, such as you may have in your, for a hospital, for example, you may have in your hospital on a regular basis, but the assumption that local community may also come in and volunteer basically, or arrive at your facility. So that plays a couple of roles. One is thinking about the communication there. The second one is also thinking about what supplies you might need for those volunteers should they come into your facility. Patients, physicians. So certainly if you're going to transfer patients, there's a lot in the new IGs about what information do you need to communicate during a transfer scenario, and then being able to get a hold of patients, physicians during that whole process is a key. So really having that communication pathway ahead of time is really important, along with other facilities to whom you may be transferring or accepting transfers from. And that really plays a key role as well. So a little bit beyond what I think we traditionally see folks thinking about from a communication pathway perspective, and very key to this whole process. And CMS actually has called out that as far as the survey criteria goes, they will be checking to review that you do have a contact list of all these different groups. That includes obviously the name and the contact information. In some cases, and we'll talk a little bit about this, you'll need multiple, more than one communication method with that individual or system. And then really that you're doing an annual review against those contact lists to make sure that information is kept up to date. So obviously as you activate your plan, you have the right information to connect with those individuals. So the other thing that the IGs call out, it was in the rule as well, but give a little more clarity is just, or emphasis, is really thinking through what your succession planning is. And so, I think as many of you probably are aware, typically when, particularly a large incident happens, there's sort of an incident commander on site. and the executive team kind of devolves down into those folks who've been assigned to those roles. And so making sure that you have key folks to back up all those individuals should somebody not be able to make it in or is unavailable for whatever reason, that there is somebody who can step into that position. And again, looking back at some of the emergencies, really large disasters that have happened over the past recent years, there have been several examples where there wasn't necessarily that succession planning, and it made response capabilities to the emergency plan much more difficult for those facilities. So we talked a little bit about really your supply chain, your essential functions. What do you need to have in place to basically continue to provide services to not only any patients you may have in your facility, but also really to prepare for what might be the community arriving at your door as well. And so CMS, the IGs really do talk about things such as considering food supplies. How are you stocked up on that ahead of particularly a large incident, large disaster? Your medications and medical supplies, making sure that you can provide those elements for patients that are really critical to continuing care should you need to shelter in place with those individuals. And so really just thinking through your supply chain is very key here as you think about preparing for the emergency. And CMS and under the IGs are really looking at that key component.
Okay, and we're going to move into our next poll. So do you have a communication plan to reach suppliers? I'm going to launch that poll right now, and I'm going to close the poll and share the results. So that's fantastic to see, actually, that if you've thought of it, you've thought of all of it for the most part. So definitely plumbing and electrical is the most important thing. It's certainly emphasized in the CMS guidelines, but also thinking about medical supplies, pharmaceuticals, and food. So that's really good to see.
That's very good.
So I'm going to hide the results and we'll continue on.
So in addition to kind of thinking about what supplies you need at your facility, again, CMS and the IGs continues to emphasize communicating and collaborating with really your local community and agencies. And so they give kind of a broad definition here, but certainly this includes any local government agencies you might be coordinating with, whether it's your county, your state, depending on kind of the depth and breadth of your organization, any other sources of assistance. So for example, coordinating with maybe churches and schools as alternate shelter locations might be one of those elements. Another one is obviously healthcare coalitions. Probably many of you belong to some sort of a healthcare coalition from your provider organization. And certainly, in some cases, collaborating with them can be very valuable, particularly on, again, broader based issues that come up. And really, from a communication perspective, similar to what we said about staff, the key here is to have an updated set of information, both contact information, name and contacts of who to reach out to in these cases, and then both a primary and secondary means of communication with those particular organizations. So again, really being as redundant as possible to make sure that you're able to collaborate with the community to get the resources that you need really to provide the care at your location and or collaborate outside of that. So this example here, is just really speaking to an element that kind of drives some of the questions to think about. So during an evacuation, when you might have to coordinate with outside facilities, for example, or outside shelters, really common questions we talk to folks about are, what staff are needed to help you drive? What is that contact list you're going to have? What essential resources are needed? Obviously, are there outside agencies? So coordinating with transport, having those arrangements in place ahead of time, whether it's ground transport or some cases, maybe even air transport available. What are those pre-arrangements? Where are the facilities and or locations you can transfer people based on your triage system and kind of how you determine in that emergency that you can route patients if they're not all sheltering in place. The other one is really, how do you support the community, right? So providing a way, what's your pathway for receiving those patients in from other facilities, other locations, and also when we get to the communication perspective, how are you informing the community of your availability to be able to do that and communicating in that method to receive patients. So that would include things typically like occupancy information. And then really key to the IGs and the survey process is, obviously being able to document and log all this information. And so there are a number of different methods for doing that, but it's really key that as you have as you're running through your emergencies, and particularly in the case of what hopefully for most of you will just be drills, as you're running through your drills, that you're documenting all that information that can be shared with the surveyors as they come in to show the efficacy of the program that you have in place. So looking back at the rule, what are some of the things that, we would recommend that you can do, particularly around the plan and communication plans capability here to help better be prepared for those surveyors coming in? So one element is, CMS definitely, and the IGs in particular, highlight that having your plans in a central location is really key and will help facilitate the survey process. Certainly that can be, I'm sure many of you have those, one option is to put those in binders, and that's one option. There are also electronic solutions available that can be leveraged for collecting up those plans and then providing them in a central location. But having them readily available for both the survey process as well as for your teams in an activation is one of the things highlighted by the IG. The second is really, reaching out and starting to collaborate with those outside facilities. So particularly in the larger scale incidents, once it reaches beyond a local thing to your facility, being able to collaborate with that outside community is very key. And so, thinking about things as how do you coordinate with the local government group? How do you set up those pathways ahead of time? Transport, medical facilities that you might either accept or send patients to. Your supply chain, again, thinking through where are you going to stock up on meds, food. Sounds like many of you have already thought through that process, which is fantastic. And then your ability to really share back out with the community and what's that process look like. So, for example, sharing occupancy information, and whether that's just over the phone or, publishing through one of the incident command systems like HICS forms or something like that, be able to share with wherever the central incident command center is. That information for the community as well.
Okay, so we're going to go into our third poll, and that is, how do you guys communicate during a critical event? So let me launch it. Okay, so how do you communicate critical information to the community during an emergency, such as those occupancy rates we just mentioned? So there's HICS forms in either paper or digital form, and another paper solution or another digital solution, or just verbal communication. I'm going to close the poll now and share the results with everyone. So, wow, verbal communication coming in second. So that would be a problem if you need to log what happens when you're working with the outside community. Other digital solution, 43%, that's great. And then those HICS forms, digital and paper, not much at all.
Yeah, so thank you for sharing that back with us. I think, interesting response. One of the things to think through, I think, with the IGs is there's a lot in there, obviously, about documentation. And certainly, I might assume from the verbal communication that maybe you're doing documentation post the communication process. Certainly that might be a streamlining capability to look at. Is there an opportunity to kind of document as you go to make that process a little bit easier? So, really, and when we think about communication, the sort of the third element that I think we've talked a little bit about in the past is really ensuring that you do have multiple ways to communicate with folks during an emergency. And CMS really does highlight this, that for many of the folks that you're going to work with, so obviously key staff, your staff, contractors, volunteers, provider, suppliers, et cetera, that you have both a primary and secondary method of reaching and contacting and communicating with those individuals during an emergency. So some very key elements there. And they also do talk about the speed of those processes as well. And so, that's another factor in all this. Really the fourth, and I think one we were highlighting a little bit with the paper versus verbal communication, is that, the ability to basically create an event log. So obviously from CMS perspective, this is a lot about the survey and the ability for them to, document that you're being compliant with whatever the rule is or the process is. But in addition to that, and what's in the IGs, I'm sure many of you also want to document from, particularly from some of the larger, longer events, what's been done where, who's been communicated with, really just to help you more accurately manage those particular events. And so, from a streamlining perspective, certainly, a lot of the solutions in the market can actually help you achieve both, where you're documenting as you go, helping you manage that scenario, and then that becomes your history later on for anyone who might come back, whether it's the surveyors or even senior management, to ask about that particular event. And then the last element we wanted to highlight is just, a reminder that in general, HIPAA is still in effect during emergencies under the CMS regulations. And so a couple of key things to think about as you work on handoffs and transfers to other facilities or other providers. There is detail in the IGs about what information needs to be communicated to those next level of providers, the next provider that you're going to pass that patient on to, including an abbreviated version of basically the health record, right? Enough for them to really be able to take the handoff of that patient, as well as any family contact information, so that they can coordinate with the family of that resident or patient as they transfer as well. And so that's really another key thing. Obviously, still under HIPAA compliance, so all PHI and protected, and has to be managed in that method.
Okay, so we're going to move into the question and answer. So we can help you run your command center, and this actually is a command center that was run recently for an active drill in Austin, Texas at Seton Medical Center. We are mobile, of course, so we can happen anywhere. So you can be in your command center, but you can be, we had one gentleman who launched an event and managed it from a canoe. So that's something that can happen if it needs to. Of course, we work with the local emergency responders, and we also work with the local community. So it's not just about knowing where the EMTs are or knowing where your hospital supplies are. It's about knowing who you need to communicate with in the community and how you need to talk to them. Perhaps English isn't their primary language. How are you going to be able to reach them in a timely manner? We do have a large supply of resources. We have a CMS Emergency Preparedness page, which has all of our webinars and white papers that we've been working on since last September. It is a very good resource. We invite you to go there and look at them. And the last picture there with the microphones, the things we really want you to think about is a lot of times something bad is going down and the press is at your door, and you're trying to do this emergency response while the press is asking a lot of questions. So how can you manage that while you're trying to manage everything else? And with that, we're going to go into the first question, which came in before the webinar today. So if the Joint Commission did my survey before the CMS regulations came in place, are they the ones who are going to come back, or will it be someone else?
So great question. So if the Joint Commission is your survey body, your survey organization, they'll remain your survey organization. The Joint Commission is currently updating their survey requirements to be compliant, and in some cases actually require even more than what the CMS regulations require. And so, for example, in the case of drills, I believe Joint Commission requires 2 active drills versus a tabletop and an active drill. And so that will continue to be true. So the way this might impact you is if the Joint Commission surveyed you this year, then, and your next Joint Commission survey is after November 15th, then that survey will actually be based on the CMS regulations versus what they might have been measuring against this year. So hopefully that answers that question.
And then we get this question on a fairly regular basis. So if you do a local community exercise, is that also a full-scale exercise?
Yeah, so that's a great question. I know a couple of you asked that question. So really in the IGs, it specifies that a full-scale exercise is essentially one where you have the equivalent of boots on the ground in the exercise. So coordinating with outside agencies, et cetera. They use it more as a differentiation versus a tabletop exercise than rather whether it's community-based or not. So the definition is really that you coordinate with outside folks, you're running through a real drill. Here's a good example. It's actually the one Lisa cited. We had a hospital down in Texas who was preparing for a patient evacuation. A patient moved to another hospital. As their final drill, they actually did that with nursing staff and patients moving throughout the facility. So it was a real live drill with real people playing the roles. That's the kind of thing that they're considering a full-scale exercise versus a tabletop, which could be taking place, I think to the question about if you run a community-wide exercise on a regular basis, that could qualify as that full-scale exercise that you're participating in. Again, assuming you're doing all the documentation, et cetera.
And then we got another question about where in the guidelines does it talk about an event log? And I'm going to answer that one if that's okay with you, Eric. Yeah. So we did do a white paper with the CMS IGs. It just came out last week. It will be in the resources that we email to you, and there is a specific page reference in there. I don't have a printout with me, unfortunately, in the room right now where I could tell you directly, but I do know that it's in there. It is also mentioned in the CMS guidelines in general, and it's part of the local community aspect. So if you want to do a word search on your document for local community and kind of read through that area, you will see it. It is something that the surveyors want to see, that you have the ability to communicate with the local community, and the only way that they can know that is if there's a log that they can review. So that's kind of the tripwire for that. So there was a question about active drills versus tabletop drills, and the Joint Commission requires 2 active drills, but CMS is 1 tabletop and 1 active. So just to kind of clarify that, if anybody has any questions there. On the safe side, you could do 2 active drills. That would be the safe side. Okay, what about coordinating as part of a healthcare system? So what do you do if you're part of several other healthcare facilities?
So that's a good question. I think CMS has said, I'm not sure if they repeated it in the IGs, but they definitely said in the original rule that if you're part of a healthcare system, you have a couple of options on your plan. First off, you can have an individual plan for your facility, and or you can participate in a plan for the entire system. So your emergency plan might be coordinated out of an EOC at the system level. And so you have that option available to you. All the rest of the rules still apply. It just becomes the locus of where the documentation happens and the operations are run out of. So all the rest of the information the IG applies, it just could be at your health system level versus your individual facility level.
We will be sending out all the resources in an email later this week. We hope you have a great holiday coming up, and we hope we see you soon. Thank you so much.